In the foot of Mount Kenya lies the Elizabeth Vendramini Naromoru Children's Home, popularly known as Naromoru Disabled Children's Home, located in Nyeri County, Kieni East at the Irigithathi parish within the Archdiocese of Nyeri. This charitable institution was founded in the year 1982 by the Franciscan Elizabeth Sisters in collaboration with the community.
This home began in 1972, in the sense that that was the time our sisters first arrived in Kenya. The priest who was in charge of this center, Father Romano Filippi, he and the other priests from Italy, in consultation with the Archdiocese of Nyeri, they decided they were going to open a home for these children. Actually, it was a home.
This home offers specialized treatment and rehabilitation programs for the physically challenged children from all parts of Kenya.
The children arrive from anywhere and anytime because they have known about us from others who have passed through our system, who have passed through our center. Others, they have heard of us through radio stations, and they have visited our website, our Facebook, and they all converge here. There are doctors also who know about us, and they refer their clients here, as far as from Nairobi, from Turkana, from Marsabit, from, we have even children coming from Makueni. And the fame of the home is what sells it outside there.
The process consists of post-operative care, which will comprise of physiotherapy care, medical care, and provision of orthopedic and walking devices.
We have a team of physiotherapists, a team of nurses who are supporting also in this rehabilitation program. We have a team of orthopedic technologists who are also supporting in calibrating most of the walking devices that these children are using.
In the orthopedic technology department, we have different sections, or we classify it into two. We have the plaster department and we have the workshop department.
The institution serves both inpatients and outpatients. The outpatients clinics scheduled every Tuesday and mainly be for children living with autism and cerebral palsy.
Tuesdays is specifically for children with autism or who have small children with their mothers. They come here and they are given the therapies.
We usually have the outpatient clinics, which are only on Tuesdays. Some of the conditions that we usually have are the cerebral palsy cases, the club feet. We also have the genu-valgus, the genu-varus. We also have the congenital malformations. We also have the flat feet. We also have the hip dislocations.
Kwa majina naitwa Wachiko. Huwa nakuja every Tuesday kumleta clinic. Anafanyiwa therapy na anafanya mazoezi juu alikuwa na shida ya mkono yake ya left, haikuwa inafanya kazi. So I have been coming here for now 2 years na nimeona huo mkono wake at least uko na change.
In addition, the institution offers physiotherapy and x-ray services for adults on a daily basis.
In this department, there are so many conditions that we manage purposely for the adults, and it runs from Monday to Friday. The clients that we encounter or the patients are majorly the elderly that are having degenerative disc disease, arthritis, low back pains, some having strokes, others have Bell's palsy, and also there are others having post-operative cases like hip replacement, knee replacement on a daily basis.
This department has been in existence for the last 10 years and has served about 8,000 adults.
So from Monday to Friday, we have the adults coming in with appointments or even from assessments.
The radiology services such as X-ray and scans were introduced in the last quarter of the year 2020 for outpatients. The Naromoru Disabled Children's Home specialized inpatient rehabilitation services for physically challenged children include 1. Pre-operative care.
From September, when these children are admitted, we do the pre-surgery preparations. Many would need the plasters, others would need feeding to boost their health in order to face the operations. Others would like mobilization so that after the surgery, they can be able to use the assistive devices. And another great help that this pre-surgery moment carries on or helps it is in the socialization. The child gets used to us, to the institution becomes a home for the child. She's able to socialize with her colleagues and they make a very nice bond that will help them through the surgical operations.
We participate in pre-operative services by doing plaster application for the cases of clubfoot. So we do the Ponseti method of management as we prepare the patients for surgeries. So during the pre-operative management or pre-operative care, we also give the plaster shoes that are made from the leather section. We give crutches and walkers from the metal section to aid in the walking and ambulation around the home.
We do the pre-operative treatment here. There are those who come with maybe they have wounds, they have other conditions which need therapy before the surgery. We take care of that. We do the laboratory tests from our Catholic dispensary which is nearby.
2. Corrective operative surgeries which are carried out by volunteer surgeons from Gasalini, the Association of Genova Orthopedic for Africa based in Italy.
In the month of September, we admit children whom we have assessed through the year and are in need of surgical. We call it the corrective surgeries.
We have surgeries conducted by very experienced surgeons from Italy through the assistance of our very equally experienced staff in the hospital. We have had a very long-standing partnership for corrective surgeries to their children.
These surgeons come to Kenya for the surgeries each year since the commemoration of the home.
My name is Silvio Boero. I came from Genoa, Italy, and I will be here. I was here since 87.
3. Provision of assertive devices which the home manufacture at their workshop.
I work in the metal section. What we do here in the metal section, it is fabrication of the assistive devices. For example, we have some assistive devices like the caliper. We usually make some calipers according to the size of the patient.
I'm Anthony Muthega Logo. I work in the Vendramini home, orthopedic department, specifically on the metal section. I was here as a former student. I'm a beneficiary. I was here in 2012 after I had an accident, and I was done 3 operations and all were successful. And also I joined college, that is Rift Valley Institute, where I graduated last year. 2022. I did automotive engineering, and here I am back in the metal section, helping maintaining the machines and also helping in the fabrication of appliances.
Another section is the leather section.
Kazi yangu nadiru na viatu. Tuseme mtoto akona crab foot ama akona shida ingine fulani.
We have the cast shoes and the orthopedic boots and the normal shoes with different types of insoles.
Hii alium splint anavalisha hapa kisha magoti inavuta upande wa nje. Inasaidia kucorrect magoti sigongane ambayo inaitwa genu-valgus.
Also we have the prosthetic and orthotic section where we make artificial limbs for those patients who have undergone amputation.
4. Provision of occupational therapy services.
In the occupational therapy department, our main focus is helping children with disabilities attain independence in the activities of daily living. We use activities in terms of games and plays, and through the activities, the children are able to do the exercises actively. During the assessments, we are able to identify some of the skills that these children have.
The mission of this home is to improve the quality of the life to persons living with disability through the provision of quality, sustainability, and affordable rehabilitative services. In line with this, the home will admit and treat physically challenged children every year.
These children are received from March up to September. So the home actually does mainly therapies within those months. In the month of September, we admit children whom we have assessed through the year and are in need of surgical. We call it the corrective surgeries.
This is a repetitive cycle that starts in the early January. Parents from various parts of Kenya stream in with their kids for admission. In the morning of 5th January 2023, the sister in charge is holding an opening ceremony with the parents and staff.
Happy New Year.
Happy New Year.
Happy New Year.
Happy New Year.
Yes, today is a great day for us at Naromoru Disabled Children's Home because this day is marked by a beehive of activities that we are receiving our students back.
Mimi nimetoka Isiolo leo asubuhi. Nikakuja nikafika hapa. Tuliambiwa hapa awali shule inafunguliwa tarehe 5. So ndio tukafuata hiyo maagizo tukakuja leo. Ile advantage iko hapa, it's a combination of school and a hospital. So anapata usaidizi pande ya physiotherapy, anapata malisho zingine anazipata hapa, kuna advice zingine mingi anapata. Kitu kingine mzuri, anaishi na watu wanafanana na yeye. So hata yeye anaona vile yako, so anaona tu kuna watu kama yeye.
Jina naitwa Millicent Waboi Theuri. Metoka mahali kunaitwa 100 Timao, na hapa niliingia last year September. Msichana alikuwa na shida hata ya mkono kushika kijiko. It was a challenge, lakini wakati amekuja hapa ameimprove yani. Juu amejua kukula, amejua kushika kijiko, mguu anatembea. Yeah, that is the change.